Hello, everyone. Thanks for joining. My name is Hisham Younes. I'm a patient engagement consultant and managing director of 360 Life Sciences Consulting. Today, I'll be moderating this session on behalf of Heal Canada. I'd like to thank you for joining in this interactive webinar entitled More Than Fatigue, Living with Iron Deficiency Anemia. This session is part of the patient advocacy initiative by Heal Canada in partnership with 360 Life Sciences Consulting and supported by Pfizer Canada. This initiative seeks to empower patients, caregivers, and healthcare professionals in Canada with the necessary tools and knowledge to manage and treat iron deficiency anemia effectively. It's my pleasure to introduce our speaker for tonight, Heba Harkous. Heba is a registered nurse currently working as the Director of Operations and Nursing Services at a fertility and women's health clinic here in Ontario, and has a wealth of international experience as an oncology and hematology nurse specialist. Heba will share her perspectives as a nurse and a person with lived experience with iron deficiency anemia. Before starting, some housekeeping notes. We open the floor for questions towards the end. Meanwhile, feel free to put your questions or comments in the chat box. And this webinar is recorded. Next, please. Next. Just one disclaimer before giving the mic to Heba. This webinar is for educational purpose only. It's not medical advice. Consult your healthcare professional. If you have any medical questions or decisions to make, do not disregard or delay seeking care based on this content. Heal Canada and the webinar host assume no responsibility for any actions taken based on the information presented. Next, please. Heba, the mic is yours.
Thank you so much, Hisham, for the introduction. Hello, everyone. It's truly a pleasure to be here with you today. As a nurse and also as someone who personally experienced iron deficiency anemia, this topic is very close to my heart. From my perspective as a nurse and as a patient, I've seen iron deficiency anemia in many patients throughout my career. But what really changed my understanding is experiencing it myself. Because when you go through it personally, you realize something important. It's not just a lab value, it's how it affects your daily life. One of the biggest challenges, symptoms are very often dismissed. Patients come in saying, I'm just tired, I'm stressed, maybe I'm not sleeping well. And even sometimes, as a healthcare providers, we can unintentionally overlook it because these symptoms are very common and can be linked to many things. But iron deficiency anemia is often hiding behind these symptoms, and the delay in recognizing it can affect patients for months and even for years. The good news is early detection truly makes a huge difference. Now, so what is exactly iron deficiency anemia? In simple terms, it's a condition where your body doesn't have enough iron. And that might sound like a small thing, but iron plays a very big role in your body. Let me break it down in very simple words, in a simple way. Your body needs iron to produce something called hemoglobin. Hemoglobin is a protein in your red blood cells, and its main job is to carry oxygen throughout your body. So think about it like this. Iron helps make hemoglobin, and hemoglobin carries the oxygen. Now, here is the key message. When your iron levels are low, your hemoglobin becomes low. And when your hemoglobin level is low, your body is not getting enough oxygen. And that's why people feel the way they do. Now, why oxygen really matters? Oxygen is essential for every single organ in your body. Every cell relies on it to function properly. So when your body is not getting enough oxygen, it doesn't just affect one thing, it affects everything. Let's start with the brain. When your brain doesn't get enough oxygen, you may feel foggy, you have difficulty concentrating, you may feel dizzy or lightheaded. Many patients say, I just feel like not like myself anymore. And this is often why you feel that symptoms. Now, the heart. Your heart has to work harder to compensate. So you may experience heart palpitation, a faster heartbeat, feeling anxious and uneasy. Your body is trying to push more blood to deliver more oxygen. And now when it comes to muscle, it comes to energy and strength. So muscles need oxygen for strength and energy. Without enough oxygen, you will feel weak. You get tired very quickly. Even simple tasks feel exhausting. Things like walking, climbing the stairs, or even standing for a long periods can feel much harder than usual. And this is why you will feel all these symptoms. The key message here is when iron deficiency anemia is not only fatigue or being tired. It affects your thinking, your concentration, your heart function, your physical strength. It impacts your entire quality of life. So when patients say, I'm tired, I'm dizzy, my heart is racing, I feel weak, these are not separate problems. Actually, they are all connected and connected to the low oxygen delivered in our body. Next, please. Now let's talk about the most common symptoms of iron deficiency anemia. These are the listed on the slide are the most common symptoms of iron deficiency anemia. And I want you really to listen to these because many people experience these symptoms without even realizing that it's iron deficiency anemia. The first one is extreme fatigue even after rest. So this is not normal tiredness. Patient would often say, or people will often say, I slept well, but I still wake up exhausted. This is because your body is not getting enough oxygen and produce energy. So no matter how much you rest, you still feel drained. Second one is shortness of breath with mild activity. You might notice walking short distances feel harder. Climbing stairs become very difficult. You feel out of breath doing things you used to do easily before. This happens because your body is trying to compensate for low oxygen. Next is your fast heartbeat. Your heart starts working harder. Patient may say, or people may feel their heart is racing, there is palpitation, sense of anxiety, but it's actually the body trying to push more oxygen throughout your system. Last is the dizziness or the lightheadedness. This can feel like feeling about to faint, feeling unsteady, like your head is not clear. And again, this is not because your brain is not getting, this is all because your brain is not getting enough oxygen. And here is the most important part. Many people experience these symptoms, but they normalize them. They think, I'm just busy, I'm just stressed, it's just life. But these are signals from your body. They are your body way of saying something is not right. So the message is here. If you're experiencing these symptoms, especially more than one of them at the same time, please don't ignore them. Ask your doctor, request your blood test, and make sure iron deficiency is ruled out. So is there any other symptoms for iron deficiency anemia? Yes, there are other symptoms that they are less common, but they are there. Additional symptoms, these are symptoms that are often overlooked, and many people don't realize that they can be related to IDA. So let's start with difficulty concentrating or brain fog. Patients often describe it as, I cannot focus, I forget things easily, my thinking feels slow, and this can affect their work, their daily life, their school. And again, this goes back to the brain not getting enough oxygen. Hair loss, and this is a big one, especially for women. People might notice increase in hair shedding, thinner of hair over time, and they may think it's a stress, hormones, or aging. But actually, it's low iron, which is it's a very common cause of these. Feeling pale skin, having a pale skin. This happens because hemoglobin gives the blood its red color. So when hemoglobin is low, the skin may look pale. Lips and inner eyelids may lose their normal color. Well, it's a subtle sign, but it's a very important one. The last one is anxiety-like symptom. This one surprises many people. Patient may feel restless or even on the edge. Sometimes they are even treated for anxiety when the underlying issue is actually iron deficiency anemia. And here's what I really want you to take from this. These symptoms can seem unrelated, like brain fog, hair loss, anxiety, or fatigue, but they can all be connected in one thing: low iron and reduced oxygen delivery. So please don't dismiss them, don't normalize them. Your body is trying to tell you something. Now, is everyone at risk of iron deficiency anemia? Well, iron deficiency anemia can affect anyone, but some groups are more at risk than others. And this is important because many people in this group, they don't realize they should be checking regularly. First, women with heavy menstrual bleeding. This is actually one of the most common causes. Every month, with every heavy period, the body is losing some iron. And over time, that loss can build up. And many women would think this is just normal for me. But heavy bleeding is a major risk factor of iron deficiency anemia. Our next most common risk is pregnant women or postpartum women. During pregnancy, your body needs more iron to support you, the baby, the placenta, increased blood volume, and after delivery, there can also be some blood loss. So iron levels can drop quickly during this time. Another risk is vegetarian and vegan. This doesn't mean you cannot be healthy or you cannot eat healthy, but it does mean you need to be more mindful in selecting food selection. Iron from plant-based food is less easily absorbed, requires more combinations, like taking vitamin C with them, for example. So without careful planning of your diet, deficiency can develop easily. People with chronic illness or gastrointestinal diseases, this includes conditions that affects mainly the absorption of iron, something like irritable bowel syndrome, celiac disease, chronic inflammation, or even medication that might affect the absorption in your stomach. Other diseases could be chronic kidney disease, malignancies, taking some medications like chemotherapy that might affect your hemoglobin level. And here is the key message. If you fall into one of these groups, you are at a higher risk, even if you feel okay. So what you should do, be proactive, ask for blood work, monitor your levels. Don't wait until symptoms become severe, because early detection is much easier than treatment later on. Next, please. So if we want to talk about why iron deficiency anemia is often missed, even though it's a very common disease, it is also very frequently underdiagnosed. First, symptoms overlap with busy lifestyle. Most of the symptoms we talked about, like fatigue, dizziness, and brain fog, can easily be blamed on everyday life. People might think, I'm just busy. I'm not sleeping enough. I have a lot going on. I'm a mom with the kids and I have to take care of the house. So the real cause gets overlooked. Second, patient normalizes fatigue. And actually, I did that myself too. So this is something I see very often. People get used to feeling tired. They adjust their lives around it. And instead of asking why they feel that way, they may say, this is just how am I? But it's not normal to feel constantly exhausted. Third thing is and this is very important, it's the normal hemoglobin. It doesn't always mean that everything is fine. hemoglobin can still be within the normal range, while your iron stores are on the low side. So a patient may be told, your blood work is normal, but the full picture was never tested or never checked. And this brings me to a key point, which is the ferritin. Ferritin tells you about your iron stores. So not just what's circulating in your body, which is the RBCs and the hemoglobin. And unfortunately, it is not always checked routinely. So what happens? Patients continue to feel tired, weak, and unwell, but they don't get the answers. And this is where we need to change the approach. We need to listen to our symptoms, look beyond just the hemoglobin, and include ferritin when appropriate when asking for a test. And if you don't feel well, don't stop at your hemoglobin is normal. Ask, can I check my iron store? Or can I check my ferritin? Because iron deficiency can be dismissed, but it doesn't have to be. Now, if you wanna, how to talk to your family doctor. This is something very important, how to advocate for yourself when you have some symptoms. Because many people don't know what to say, and they leave the appointment without getting the answers needed. So first, explain your symptoms clearly. Be specific. Instead of saying, I feel tired, try to put a combination of symptoms. For example, if you feel them, for example, I feel exhausted even after sleeping. I get dizzy when I stand up. I feel shortness of breath doing simple things. The more clear you describe your symptoms, the easier it is for your doctor to understand the full picture. Second, mention key symptoms to the doctor. Don't leave things out. Make sure you include fatigue, dizziness, palpitation, brain fog. So if you just focus on one symptoms and not the combination, you're not telling the whole story. Third, express concern about iron deficiency. So you can say and it's totally okay to say, I'm concerned this could be iron deficiency anemia. You're not questioning your doctor here. You are participating in your care. And this is the most important step. Ask for the right tests. You can say, can you please check my CBC and ferritin? Because CBC looks at your hemoglobin and ferritin look at your iron stores. And both of them are important. And finally, if your symptoms continue, don't hesitate to follow up. Advocating for your health is not being difficult, so at least advocate for your health. It's being responsible. So my message is simple. You know your body best. If something doesn't feel right, speak up and question. Now, what to say? Simply, sometimes it's not about knowing everything. It's about knowing what to say. These are, as seen in the slides, very simple examples that you can say. I've been feeling usually tired and dizzy. I'm concerned this could be iron deficiency anemia. Would it be possible to check my CBC and ferritin? So please be clear, respectful, and confident. Next, please. Okay, because now understanding your results. Because this is where a lot of confusion happens. Many people are told your blood work is normal, but what does that actually mean? There are as I said, two key tests for that you need to know about iron deficiency anemia. The first one is the hemoglobin. Hemoglobin tells us about if you already have anemia. So meaning your red blood cells are low. So when hemoglobin is low, that usually means the anemia is already established. But if your hemoglobin is low, the doctor will say, oh, you don't have an anemia. The second and very important test is the ferritin. Ferritin tells us exactly about your iron stores, how much iron your body has saved. You can relate to it as iron reserve. And now here's the key message. Your ferritin can be low, even when your hemoglobin is still normal. So what does that mean? It means your body is already running low in iron, but it hasn't reached a stage for a full anemia yet. This is what we call an early stage of iron deficiency anemia. And this is where many cases are missed. Because if only hemoglobin is checked, everything appears normal, but the problem is still there. It's still starting and going on. That's why both tests are normal. The hemoglobin,
Uh, Heba,
yeah.
a question here, because you
Mhm.
mentioned something about hemoglobin, please. So if the doctor sees hemoglobin and hemoglobin is not low,
Yeah,
the doctor might say you don't have iron deficiency anemia.
exactly.
Okay.
Yeah, so here comes your part. Here comes where you advocate for yourself, okay? Where you take care, part of your taking care of yourself. So we tell them, yes, my hemoglobin is low, but I still have like symptoms. I cannot climb the stairs. I feel tired if I talk for a long period. I feel like my heart is racing. Combine these, and in a polite way, you can ask, can you check my ferritin level?
You
Okay?
mean my hemoglobin is high, but still I might have anemia. So check
Of
my
course.
ferritin.
So
Okay,
the first
excellent.
stage of iron deficiency anemia is when your hemoglobin is normal, but your ferritin is low. But when you use all, let's say, your iron reserve, at that point your hemoglobin will start dropping and your symptoms will become more severe. Okay?
Okay.
So you're welcome. So my message is again, if you have symptoms, don't just ask, don't be satisfied with your hemoglobin is normal. Always ask about your ferritin level, because catching low iron is early. It means easier treatment, faster recovery, and preventing symptoms from getting worse. Next, please. Treatment options. Well, here we always advise you to work with your healthcare provider to find the best option for you. But in general, treatment option of iron deficiency anemia is taking the iron. And iron come in two forms. We have two forms, IV and oral or capsule or liquid form. And all of them, they have the same goal. First of all, they restore your iron level. Second, they improve your symptoms after that and addressing the underlying cause. Now let's talk about one option of treatment, which is a common option on treatment in the next slide. Oral iron supplements. Oral iron supplements is the first line treatment for most people. So this is the first time treatment. Whenever you're diagnosed with iron deficiency anemia, the doctor will check your ferritin level, your hemoglobin level, and will decide on what type of iron you should be taking, what is the dose of iron that you should be taking, and what form of iron and frequency and duration. So the available types of iron tablets comes in pills, capsule, and liquid. Some of them, they need a prescription from your healthcare provider, and other they just like over the counter. Usually they're taken from weeks to months to rebuild iron store, and here is a slow process. So that's why you shouldn't be stopping your iron unless you're advised to. Well, like any other medication, iron tablets might have side effects, something like nausea, constipation, stomach upset. So my advice for you as a nurse, if you experience any side effects with the iron, don't stop it only. You can just like call your healthcare provider and tell him or her about your symptoms, and then they will advise you. Now, there is another form of iron treatment, which is the intravenous iron. So when do the doctor give you intravenous iron instead of oral iron tablets? It's literally when the oral iron tablets is not tolerated, or it's not effective, or your body is not absorbing it due to any gastrointestinal disorder, or when the doctor wants a fast correction if needed. So those with the more severe, let's say, cases, or those who are not tolerating the oral iron, they can shift to intravenous iron. Now, if this is this reachable to every single person, like, can I go and request it for myself? Well, you have to discuss it with your healthcare provider first, and this is given in a healthcare facility. It's by an appointment, and it's a tertiary and intravenous infusion given at less frequent, it's not given daily. So the doctor will decide how many doses and what is the frequency. Of course, it has also side effects, like that you may develop rash or nausea during the infusion, sometimes dizziness. But the good thing about it that it corrects the iron stores way better than the tablet form, and quicker. In more severe cases, the doctor might decide on giving you like a blood transfusion. For example, for those who have like sudden severe bleeding, they will not be able to correct that with iron tablets or infusion. They might require a blood transfusion.
You have 5 minutes left, Heba.
So yeah. Next, these common mistakes. Now let's talk about some of the common mistakes I see. And I say this as a nurse and as a patient. The first mistake is stopping iron supplements too early. And this happens all the time. Patients start the treatment, they begin to feel better, and then they stop. But iron deficiency anemia is not corrected overnight. Even if symptoms improve, your body still needs time to rebuild its iron stored. The second mistake is feeling better doesn't mean your levels are back to normal. So it's very important. Symptoms improve first, but blood levels take longer to recover. So if you stop that treatment too early, the deficiency can come back again. Next slide, please. So again, follow-up key. The follow-up key, the key is simple. Follow up with your blood work, monitor your ferritin and hemoglobin, continue your treatment as prescribed, and don't stop too early. Because treating iron deficiency anemia is not just about feeling better, it's about fully correcting the problem and making sure it doesn't come back. And remember, follow-up is not optional. It's what makes the treatment work. Sorry. Now let's talk about what happens if the iron deficiency is left untreated. And this is something I really want everyone to understand. Iron deficiency doesn't just stay the same. If it actually gets worse with time, your body continues to lose iron and your ability to carry oxygen become more affected. So what you start to feel at first, it's like mild, but gradually you will feel more tired, more dizzy, less able to do your daily activities. Things that used to be easy will start to feel exhausting. Then symptoms can progress and you may start be experiencing shortness of breath. And in more severe cases, your heart has to work harder to compensate for the lack of oxygen in your blood. Then that can lead to heart strain, palpitation, and overall stress on your body. So the key message here is iron deficiency is not just about feeling tired, it affects your entire body. But the good news is it's very treatable and completely manageable when caught early. If you don't feel like yourself, don't ignore it. Iron deficiency anemia is very common, but very treatable when caught early. So listen to your body, speak up, and advocate for your health. Thank you so much.
So that was amazing. Thank you so much, Heba.
Thank you.
Very informative. You could feel the depth of the experience as a nurse and
As a
as a
patient.
person with lived experience as a patient. And that's a powerful message at the end for any patient or any person feeling those symptoms to advocate for themselves and to have the right conversation with their doctors. Perfect. So now we will open it up for question. And Hiba, I'll start with the chat questions, and then we will open the floor for the participants to ask. So so questions and comments from the chat box. I see one person, Sharon, says, "I see all these symptoms, the symptoms you described as common symptoms for iron deficiency anemia. A lot of thanks and compliments for the session. Interesting, informative." Uh, One question is, how can one regain, I guess, iron, right? So get rid of iron
So
deficiency anemia and regain the iron levels to normal.
Okay, so first of all, I would advise Shannon to seek help from her family doctor or like her healthcare provider because she has symptoms. Not every symptoms might mean iron deficiency. It can be something else, but also it can all many symptoms can mean iron deficiency. So please, Shannon, go ahead. CBC and ferritin. For the other question, how can we replenish our iron stores? Like
Yes.
let's start with doing
And
a
Sharon, if we didn't get the question right, let us know. I
yeah.
guess that's what you meant.
So, how can we replenish our iron stores? We mentioned that first of all, we need to do a hemoglobin and a ferritin level, and based on your hemoglobin and ferritin level, the doctor will give you the proper treatment for what treatment option you might need. It's either and what is the cause behind your iron deficiency? So he will either decide on an oral, IV, iron, or any other types. How can you help yourself? Well, eat some foods that are rich in iron too. For example, red meat like beef and lamb meat, turkey and chicken, salmon and tuna if you like the fish. You can eat veggies like spinach. You can eat lentils, chickpeas. Try to boost absorption of your iron by taking lemon and orange, but it's very important to mention that diet, if you have iron deficiency and anemia, yes, you can take diet that is rich in iron, but it doesn't substitute your treatment.
Well, one comment, a baby born without a cry for some minutes, is he at risk? That's a question. Is he at risk of losing iron?
That's a good question. So babies, when they're born, actually their iron stores are low, but the doctor can explain more about that. And they usually take that in the supplements later on. But if he didn't cry, it means, well, he didn't get the oxygen yet. There is a lot of things more important than concentrating on his iron store. I want him to breathe. I want him alive.
Again, um, great presentation. Glad to be part. There's also excitement for being part of any patient advocacy groups coming up for iron deficiency anemia. Um, thank you, thank you. Amazing session. Okay, can we use calcium? A question by Liam.
That's a good question, Liam. Thank you for asking that. So my answer is the following. If you have iron deficiency anemia and you are on iron treatment, okay, milk, calcium, coffee, and tea might decrease the absorption of iron. So I would say decrease taking these supplements, this intake, but it doesn't mean you stop them. Actually, you can separate between taking milk, for example, or calcium tablet and your iron tablet in 1 to 2 hours. So you can take your milk and then 2 hours after you can take the iron, or just the opposite.
Presentation, amazing session, insightful, great lessons learned. Thank you so much. Oh, thank you, Liam. I rate this webinar with a 5 star. Thank you.
Thank you.
Okay, thank you from Bianca. I think that's all what we have in the chat box. Please, this webinar is meant to be interactive. Thank you from Annabelle, of course. Um, please feel free to share, keep your camera off or put your camera on. We would love to hear your questions as well, in addition to reading them. Thank you, Esmeralda. Very educative, very educational. Thank you. We still have 10 minutes open for questions, so please feel free and
So
take the
let's
opportunity of
hear
having
back,
this
Hisham.
conversation.
Hisham, sorry for the interruption. So if we don't have a question, let's hear back from them. Let's hear back and see who is at risk for iron deficiency anemia. Is it women or men or both? Yes, the webinar was recorded, Liam.
Okay, so you're trying to
To
run
see.
a quiz here?
Here's the quiz.
I
Well,
mean, it's
I'll,
good to
I'll
come
answer
back to
that
key
again.
points.
Yes, I'll answer that again. Everyone is at risk of iron deficiency anemia, but there is more groups for that they are more risk at iron deficiency anemia, with whom like women, menstruating women with heavy menses, pregnant women, those with GI disturbances. So all of these are at higher risk and they need to check themselves more frequent.
Great engagement in the chat box. There was a question around the webinar being recorded. It is recorded and it's going to
Mhm.
be posted on Heal Canada YouTube channel. We had also one previous webinar about iron deficiency anemia and one coming up also on May 6th. So stay tuned also for the next webinar. Please visit healcanada.org website for the links. Technical question, I guess, Cheryl. For Cheryl, great session. How is the coffee gift card received today? If you can answer that in the chat or unmute Cheryl. So
Okay.
since they mentioned coffee, I have a question about coffee and tea. Would
Yeah.
that help, like
Like
iron
coffee and tea.
absorption or?
So yeah, that's why it's the same question as Liam asked. It's Liam asked the milk. The same goes for coffee and tea. So coffee and tea decreases the absorption of iron. So it's preferably if you want to take a cup of coffee or like you don't want to miss it, then separate your iron intake around 2 hours before or after. Okay.
Thank you.
Okay.
The chat box is still busy. Many participants are thanking you, Heba, for the
Mhm.
presentation.
Thank you for attending the presentation too.
Super insightful. Okay. Uh, Thank you again, Heba, for a great and insightful
Thank
presentation.
you, Hisham. Thank you,
We really hope
Cheryl.
that, of course, we really hope that this webinar and the patient advocacy, the
Of course.
Iron Deficiency Anemia Patient Advocacy Initiative by Heal Canada helps
Yeah.
patients, helps the general public to be more aware, patients, caregiver with iron deficiency anemia. We hope that the presentation today was informative and insightful. Thank you so much, Hiba. Thank you,
Thank you so much
everyone.
for the
And that's a wrap.
opportunity. Thank you, everyone.
Of course. Bye bye.
Bye.